Okay, do I remember the 10 awards? I know overall best graduating male, overall best graduating student. I think I'll call it an epiphany. It just like landed in my head. Boom. Interventional radiology. Like, I actually want to have a family life. I want to be present, a present dad. Present. And then I got to the radiologist. And the first thing he said was, what car should I buy in December? Like that just like you get it, yeah.
Yeah.
Like, okay. So I mean, it's not all about the money, but it's definitely a motivator.
Still go, even when there's no hope, you can still go. I never answer to no, man, I still go, 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 go.
Hi, Aaron.
Yeah. Hi, Belinda.
Yeah. Please, are you ready for your 23 questions?
I'm more than I was born ready.
Catch. Okay. Question number 1. What is your name?
Do you want me to go casual or like as if I'm consulting and I'm giving you my professional?
Professional name, please.
Okay. The name is Dr. Dagadu Aram Maululu. Well, Aram is the first name, so
Yeah.
Dagadu is the last
Heavy name. Please share with us the specific area of medicine you are currently training in.
Okay. I am currently a first year radiology resident. I think I'm about 8 months into training. Under the Ghana College of Physicians and Surgeons, and I'm currently training in Kolebu Teaching Hospital in Ghana.
What has been your experience so far in terms of learning and professional growth?
Okay. I'm guessing this question is not limited to just the radiology residency.
Not at all.
Okay, then I would say, in my opinion, it's easier on hindsight when you look back. When you're in it, it feels like it's a lot. It feels like it's difficult. People would want to give up and all. But then when you're actually done, well, I mean, in medicine, you actually never finish. But when you're done with one milestone and you look back at the journey, you realize it's kind of doable. It's quite easy, so to speak. So for me, I would say the experience has been enlightening, and I feel I have grown more than I thought I would have been able to. Case in point, when I was in secondary school, in fact, let me start from JHS. I completed JHS with aggregate 10.
Okay.
I remember when my dad went to check the results and came home, my mom was expectant. What did he get? What did he get? And my dad said he got 10. Those days we used to write 10, like,
Yeah.
10 subjects. So she thought he meant 10 ones. I see her dancing around the house. But I was like, oh no, it's grade 10. And she was like, oh, grade 10. And her reaction even broke my spirit. Actually, we moved. Yeah, and fast forward in secondary school. I don't know whether you asked me what secondary school I attended.
No,
Okay,
I
cool.
won't.
So fast forward in secondary school. I attended to my secondary school.
Okay.
And I wouldn't say I was the best. I mean, people used to call me a shark, but I was never first in class. In fact, I was only first in class once. No, I was second. Actually, I was second
Okay.
once, sometime like in my third year or so. But throughout my 4 years, I was like constantly eighth, ninth, eighth, ninth, eighth, ninth. That was my constant. So they were like top guys there. And then I graduated. I didn't get 8 A's. I didn't get 7 A's. I didn't get 6 A's. I had 5 A's
Okay.
and three B's. I think 2 B2s and 1 B3 also. And leg didn't take me. Tech didn't take me. So my year after SHS, I was home. Like that whole year, I didn't go to school. I didn't come to the medical school immediately. I was doing other things. And then I tried again the following year, and the UCC took me. And I was in class with people who had 8 A's. So One thing our seniors used to say and some of our lecturers used to say was, "What I will always find is level." I'm just telling you this story to show. I wasn't always. I didn't come from like. I mean, yeah, I was a shark, but not like that. But I guess an enabling environment, course structure, find yourself. Like I think I found myself over the years, and
Okay.
then gradually went through the school, and the rest is history.
We are glad you found yourself.
Yeah, so I think everybody will find themselves. What I will find is level
Yes.
always.
Yes.
I don't know if I've even answered the question. The academic experience and my professional growth. I don't know if I've answered the question.
Which medical school did you attend?
And I'll say it again: the best university medical school, the best medical school currently in Ghana, the
Okay.
University of Cape Coast School of Medical Sciences.
Okay. All right. Dr. Aram, during your graduation from medical school on the 9th of September 2019, you were honored with 10 awards and recognized as the overall best performing student.
Hey, is that so?
Can you recall the specific 10 awards you received?
Hey,
And could you share some insights on the factors
Eh,
and strategies that contributed to your success during your medical education?
prior to starting the radiology residency, I used to work 12 hours, two jobs every single day, no breaks, no weekends, no holidays, back to 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 back. And then I started radiology residency and I got my first weekend off. And I was like, whoa, whoa, where have you been all my life? Of training, easy battle. Okay, do I remember the 10 awards? I know definitely, I know anatomy, physiology, biochemistry, I think medical informatics. Uh, hey, should I remember them? I know the overall best. There were like two or three of them. So overall best graduating male, overall best graduating students. I think. Yeah, I don't remember them. I think
Okay.
Kempath. Um, a number of them. Sorry. At the end
Okay.
of the day, were 10. I don't remember.
Okay. Could you share some insights on the factors and strategies that contributed to your success during medical school?
Okay. Um, I think the main contributing factor was the fact that I was selfless with knowledge. Yeah. I guess understanding things come easy to me. So when the lecturer says it once, I think I get what he's trying to say, while others may not exactly maybe understand exactly what he's trying to say and may have to read something else. Or I just get what he's trying to say. So my strategy was I didn't like to write in class. So I go to class working with just my phone. No bag, no books, no pen. Not okay, maybe pen to sign the attendance.
Attendance.
Yeah, but then I couldn't have done it alone because at the end of the day, I still need some notes to read. I had classmates who were very good at taking notes. No, we're very good friends. So and he used to type. So whilst he's in class, lecturer is teaching, he's typing notes, and then that way I can just take a copy on a pen drive or something, and then I study that. And aside that, I used to watch videos a lot. Dr. Najib. Yeah, people didn't like his accent, but I used to watch it. If it is a 2 hour video to explain one small topic, I will watch the whole 2 hours. And that seemed to be, I didn't have to even read again. Like after watching the videos, I was more of a visual learner. And then most importantly, when I said I wasn't, I was selfless with knowledge, I meant after I have acquired the knowledge and I've understood it, I go out there and I go and teach. So I used to teach a lot. So I try to cover what has to be covered early enough. Not like I wait last minute and then I'm now studying. So because it's the last minute that people are now studying, people are trying to understand things. So I do that early enough, and then when people are preparing for exams, I am the guy you come to be explaining things to you. If I have to be studying around that time, I'll not want to sacrifice my time to teach you. So I'll clear that early enough, and then so if I come to this room, I teach. I go to this room, I go and teach. I go to that room, I go and teach. By the time I go to the exam room and that same question comes, I have taught it 10 times. I have organized it in my head already.
Mm.
How can you feel? So that was what helped me most. The fact
Okay.
that I loved to teach.
Okay. So, what stands out to you as your favorite aspect or memorable experience during your time in medical school?
Hmm. My classmates. Not too many good memories from first year. From first year, we just gelled. Like I can't pinpoint one specific memory, but we've had a lot of memorable times, from sports to CMF to sometimes organizing our own parties, Kobis,
Mm-hmm.
uh, even our final exams. There was a time, I think final part one. I think final part one. Um, we went to write this exam and the MCQs. I think you know when the lecturers are submitting their questions, I think they highlight their answers also. So they highlighted the answers in I think it was in red. But then when they're printing it, they printed it in black and white, thinking that it's all going to do black and white. But there's some smart people who noticed this, like the answers seem to have a different shade of black. Like
Mm-hmm.
it's a different shade of black. So this particular guy in my class, he noticed it and he didn't spare. We had 150 over 150.
Wow.
Some of us didn't really notice. We were racking our brains, using our brains to answer the whole question, but some people saw it. And I mean, if you've seen it, I intentionally get some wrong here. I don't know. Just 150 over 150. And it became news. Charlie, they had to cancel the whole paper. We had to
Oh.
rewrite it. And this time, the second time we rewrote it was not a joke. So I mean, we've done things. My class, we've done things. When it comes to sports, too, don't go there. When it comes to debating, our debate competitions, we used to, and I used to feature in almost all of them. So sports, debating, parties. Well, as for the memories, uncountable. Even now, when we are going for my classmates' weddings, they're getting married small, small. So yeah.
Okay. Which specialty did you envision yourself pursuing when you were in medical school and why?
Okay, that one needs to change. Uh, Initially, well, but it's always revolved around surgery. So, because started off liking anatomy from the get go. People used to complain about it. People didn't like anatomy, but me, I understand. I didn't understand why they didn't like it. Probably because of the method of learning. So I was watching videos. So me, I loved it. I always thought I'll be a surgeon. And as you learn new things, you start seeing yourself. At a point, I think I even considered psychiatry because I was enjoying psychiatry. We did neuro, and then now I did well in neuro, and I was like, I think I'll be a neurosurgeon. So it's changed based on the exposure, yeah. But I think sometime in final year, when I was preparing for my final exam, I was in the pavilion studying, not even thinking about what specialty I wanted to do, and I got, I'll call it an epiphany. It just like landed in my head, boom, interventional radiology. Like, hmm, interventional radiology. I mean, it's still anatomy. Radiology is mainly anatomy, and I love procedures. That's why I was thinking of surgery, and interventional is procedures. And I don't want to live my whole life in the hospital like some of my surgery bosses. I actually want to have family life. I want to be present, a present dad, present husband. And if I'm spending my whole life in the hospital, the interventional radiology seems to check all the boxes for me. And I wasn't even thinking about it when it landed in my head, but I guess I've stuck to it. I've committed to it.
What led to a change of mind regarding your initial specialty aspiration?
Yeah, so I think I may have touched on that a little, but um, even at the point when I decided on radiology, when I was done with my house job in general, my last rotation was obstetrics and gynecology. When I was doing it, I mean, I loved it. So I was even seeing myself doing obs and gynae. Ladies, my classmates, like friends and stuff, they were all telling me they wanted me to be their gynecologist, they wanted me to be their gynecologist. And I was seeing myself doing it. So when I was about leaving, my boss, the specialist at the time, called us to have a small meeting and he asked all we wanted to become. And I said radiology. I was like, okay, I mean, it's not bad, but I shouldn't close my mind on other possibilities because uh, sometimes your choice of specialty is dependent on the discipline you find yourself doing as a medical officer. He himself wanted to be a surgeon, but when he started working in that particular hospital, he was in the obstetrics and gynecology department. He was a medical officer there for like 3 years, 4 years. He had already acquired all the skills. All he needed was the certificate. So it just kind of the interest just grew, and it happens to a lot of people as well. You end up being an MO in internal medicine and just kind of develop the interest. Yes, but for me, I'll say I was fortunate in that I didn't have to become a medical officer in any specific discipline. I had already planned on radiology, and just before I finished house job, someone called me willing to sponsor me to start my residency in radiology. So it was kind of like an easy transition for me. So really, yeah, it's like things just fell in place after I made the decision.
Okay. Were there any specialties that you absolutely ruled out? If so, why?
Pediatrics. uh, Pediatrics. One for adults. One you can use one dose for all of them. And once you learn one dose, Charlie, you can apply it to all adults. Children, if the child is a 1 year old, the children from if the child is a 5 year old, if the child is the doses vary based on the weight. And it was just too annoying to learn. And and when you actually start working in the pediatrics department, almost everywhere, it's almost like the social issues are too many. It's, I mean, don't get me wrong, I'm not heartless, but when you go to work as a doctor and your focus, your thinking is more around social things. How is this child going to pay? How is the mother going to pay? Most of the time, they can't afford the treatment. It can be very depressing sometimes and a moral dampener if you're not there. So the pediatrics department was, I just go there, do my job, and I leave. Yeah, I didn't see myself doing pediatrics. I didn't see myself doing pediatrics. I
Okay.
mean, kudos to those doing it.
What was it about radiology that first made you fall in love with this field? Was there a specific experience, mentor, or aspect of discipline that ignited your passion for it?
Okay, so unfortunately, in medical school, we don't get a lot of exposure to radiology. So it actually came as a shock to a lot of people when I told them that I'm doing radiology, like I'm pursuing radiology. What about it caught my attention? Like I said, it was an epiphany. I wasn't really thinking about it. It just, I knew the check boxes I wanted checked out, and it was just at a moment's notice that radiology just kind of passed through my brain, and I saw that it actually checked off all the boxes. And then now, after that had dropped in my brain, I now started finding reasons why it would be a good fit. It was like, look at this specialist. Look at the lifestyle he's living. I think I want that lifestyle. Look at the car he's driving. There was actually a time when we were having this career day where we got so many specialists to come and talk to us about their specialties. And every one of them would come and this one will come and talk about how difficult it is and how stressful it is. And almost all of them were following the same pattern. And then they got to the radiologist. And the first thing he said was, what car should I buy in December? Like that just like you get it, yeah. Like,
Yeah.
okay, okay. So I mean, it's not all about the money, but it's definitely a motivator.
Okay.
Another time I went to actually see him and to talk to him, the radiology specialist. I was still a student then. I told him about my intentions. I was like, okay, sure. But if I'm lazy and if I'm coming in for the money, I will not make it. I was like, okay, I am not lazy. And I think I can develop an interest for it. People say you have to have a passion for what you are doing, but I believe you can make a decision and then develop passion for it.
How long does it take for your radiology training?
It's in Ghana. Diagnostic Radiology is a 4 year membership. So yeah, 4 years. That's basically how long it takes. Longer than the other specialties that are looking down on radiology. So that should tell you something.
From your perspective, what sets radiology apart from other medical specialties?
Okay, I'm going to. Okay, so radiology, they call us the doctor's doctor, and I think it's a well deserved title. We are the ones you come to when when you are confused about something. I mean, with other specialties where you're not actually seeing what's going on inside the person, you can only guess intelligently. You can only guess. But then when you are at your wits' end, you would actually go and see the radiologist. And then when the radiologist tells you it is this, you accept it and then you work with that. So that's actually kind of some kind of power that the radiologist has. Of course, sometimes the radiologists also see things and then we say go for a tissue biopsy. So then the pathologist is like above, but then the radiologist holds some power. So that's good to know. And also we are not limited to one body part. When you become a radiologist, you are kind of you know everything about every other specialty. And of course, there are subspecialties under radiology. So you can go into neuroradiology or GI radiology. Some choose one part and then go there. But by and large, you can be a radiologist in general and serve the needs of all the other specialists in all other specialties. That's what makes me feel like I love it, and I feel like I'm at the right place. Some would tell me it's a waste of my brains, but but when you think about it, having to know what's going on in other specialties, knowing their diagnosis. I mean, I have to diagnose. When I look at the image, I have to give a diagnosis that fits your specialty. So if you're an ophthalmologist and you call me to do a B scan of the eye, I need to know the conditions that you as an ophthalmologist treats and give a diagnosis along those lines. If a neurosurgeon sends a CT scan to me, I have to give diagnosis along his lines. So I have to know what they do and what they know. So yeah, radiology.
Are there any common stereotypes or misconceptions about your field of study?
Yes, some people believe that radiology is a place to relax, and that's it is only lazy people who go there. Those who don't want to work a lot who go there. Those who don't like human interactions who go there. People feel like generally it's easy, but well, I mean, like human interactions. That I am the atypical radiologist. Although it was a little stressful sitting down listening to people's complaints, 30 plus, 40 plus people every day, complain all the time. It's a little exhausting, but I was good at it. But yeah, it was also exhausting. But the common stereotype is that radiologists don't like to interact with people. I'm a people person, but even people need a break, right? Okay. The other thing is that radiologists are lazy, which is not true. I've come to see the amount of work that goes on in a radiology department, and just this past month, I've had the opportunity to shadow one of the radiology specialists, and even when he's not at work, like visibly at work, he's working because they send him images throughout the day, throughout the day, and whatever he's doing, wherever he is, he stops, writes the report, sends it for just to allow flow of work to go. But the thing is with radiology, it's rewarding because you are seeing you are every report you churn out comes with benefits, and so you are seeing the rewards from your hard work as opposed to being on a, being like a surgeon in a government facility or a physician in a government facility where regardless of the number of patients you see, regardless of the number of surgeries you do, regardless of the number of times they call you in the night, I mean, sometimes it feels like you're not seeing the worth of your efforts, and that can be a little demoralizing. But the misconception is that radiologists are lazy. It's not true. It's not true. They're actually working. I went to UGMC to do a few rotations, and their work schedule is crazy. The radiologists there work. They go there from morning like 8 a.m. till 6 p.m. and then they go home. But then the images are still being taken whilst they are away. And then when they come, all the images that were taken in their absence, they have to report on all of them. It's like it's a lot of work. So radiologists are not lazy. So yeah,
What is the toughest part of your specialty?
I think the toughest part is the training. Tough training, easy battle.
What is
Yeah,
the most rewarding part?
when you're done training. Yeah, well, yeah. When you're done training, yeah. One in Ghana, there are not many radiologists, and so if you are wild, you can establish yourself in a good niche where you are the authority, and more cases means more money. One of my colleagues, she just turned specialist recently, and she said she went to do a locum, right? The current medical officers will tell you if you're going to do a locum, you are paid anywhere between, let's say, 150, 150 cedis to, let's say, 300, 350, aqua 500 per shift. Aqua, that's in the like very elite areas per shift. She went to do an ultrasound locum, scanned about 15 patients that day, less than half a day, and she was done. And she left with like 1,800. I mean, that's like a big jump compared to that. That's just one less than half a day, 15 patients, and that was the reward. So what a radiologist can make in like 30 minutes, a surgeon will have to stand on his feet for like 2 4 hours plus in order to make the same thing. So I mean, I'm not advertising radiology, but those who are, just think about
We
it.
understand. What does an average day or week for a radiology resident look like?
Okay, so I think it depends on your training facility. But for me in Kolebu, every month we have a rota, we have a timetable. So dependent on which imaging modality you are sent to, that's where your month is going to be spent. So let's take let's take my most recent rotation. I was in CT scan. So we have morning meetings Mondays, Wednesdays, Thursdays, and Fridays. So from 7:30 a.m. to 9 a.m. We have kind of like an academic session. One resident is given a topic to present on. Then after his presentation or her presentation, a specialist comes and takes us through some image viewing or something or a tutorial of a sort till 9 a.m. Then you go to work. So from 9 a.m., whichever modality you've been assigned to, you go to work. Then sit down, and if it's ultrasound, you are scanning. The patients are coming, you are scanning and writing reports and scanning and writing reports and scanning and writing reports until you're done for the day. There's no closing time. There's no lunch time. It is when the job is done. So depending on how fast you are, when you're done for the day. So if you are a junior, you definitely need a senior to at least vet your work for you. So CTs, for instance, you they send out the radiographers will take the images, forward it through our PACS system, and whilst we are sitting in our reporting rooms, the images come in and then we pick them, go through, write our reports. And the specialist comes later, so now go through the images again and our reports with all of us.
Okay.
And I mean, some of them take it as a teaching session, so that's why sometimes like we actually spend a lot of time there. I think that's why sometimes some other training facilities close much earlier than us. But in Kolibu, you are there alone for the first few hours doing the work alone, and then later on the specialist will come and they will now go through all the music again with you. So even there were 30 cases you did that day, go through them one by one. Sometimes you can close very late, 10 p.m., 11 p.m. Yeah, but at least we don't have night shifts, so and we don't have regular weekend shifts. So
Okay.
at least someone would have to be on weekend duty. But since there are a number of us, you will be on weekend shift maybe once in 2 months or once in 3 months or something. So that's a welcome change.
Okay. What has been the most intriguing case you have come across so far?
Hmm. Uh, okay, so for the medical students around, you can look up cherubism, CHERUBISM, cherubism. Should I describe it? So it was a young lady, came in for a CT scan, has this swelling of her jaw, the jaw area, and we did a head CT scan for her. And how do I describe this for you guys to see exactly what I'm
Summarize
saying?
it for us.
Okay, so basically the bone, her maxilla, I mean her facial bones were expanded due to multiple air-filled cysts within the bone. It was very huge. That was one I'd never even heard that name before prior to seeing that. Another interesting one was an abdominal CT scan. You know, as a first year, we usually run away from difficult cases. Actually, Mr. One Boy, I saw his abdominal CT scan and I said I'll do it. And I don't know what I was looking at. I saw what I thought was the gallbladder on the left side. What was on the left side? Yeah. But what I thought was the gallbladder on the right side of the patient. It looked very big. The walls were very thick. A lot of air in there. What I thought were lymph nodes, other areas. I gave some wild diagnosis. I said it's emphysematous cholecystitis because of the thickened walls and the air and all that, the lymph nodes. But apparently, it was the stomach that had moved to the right side. that I was there. The stomach was on the right side, and what I thought were lymph nodes were actually what we call splenials. So she didn't have a spleen; she had splenials. So if you look at the area, normal area where the spleen should be, you will not see the spleen. The spleen was rather on the other side, and like that. So that also was an interesting one. This situs inversus malrotation things. Yeah, that was also quite interesting.
Oh, okay. So I'd like to give you a minute Let's say 30 seconds. I'm giving
Okay.
you the chance to sell your specialty. Why should someone choose radiology?
I think I've been selling this for for this whole presentation. I don't know what more to say. Uh, I love it. Prior to starting the radiology residency, I used to work 12 hours, two jobs every single day, no breaks, no weekends, no holidays, back to 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 back. And then I started radiology residency and I got my first weekend off. And I was like, whoa, whoa, where have you been all my life? Yeah, so you can work from home. You can spend time with your family and still be productive. Uh, if you do it well and you do it right, you can actually live a fulfilled life. I think. I
Guys.
think. I think.
Okay.
Yes.
Turning it around. Why should someone not choose radiology?
Yeah. Don't choose radiology if you are coming for the wrong reasons. Um. Yes. You should think about what you are going to get out of it. Definitely. But then, if that's your sole motivation, you are going to quit. A lot of people start and they don't finish. And it's not only for radiology, it's true for life in general. Like I said, you have to build a commitment to whatever it is you are doing because it's hard. And what is the motivation to continue? If something is difficult, why should you continue? Why would you keep telling yourself to continue? Why would you keep putting yourself through that if it's difficult? If you have not built some kind of commitment towards it. So if your motivation is not in the right place, just don't start. Just don't start. You will stop. You will quit.
What steps or activities would you recommend to a medical student, a house officer, or any doctor aspiring to pursue a career in radiology that can improve their chances of getting entry into the program?
Okay. So first and foremost, make up your mind early. One of what helped me was the fact that I decided early enough and I committed to it. Imagine if the opportunity of sponsorship came and I didn't know what I wanted to do. I was still weighing, do I want to do medicine? Do I want to do radiology? Do I want to do surgery? At that point, if the opportunity came, I wouldn't have grabbed it because I was still uncertain. I would have still been uncertain at the time. So decide on what you want early. And then, well, luckily now the current rector for the Ghana College of Physicians and Surgeons is putting steps in place to help people get into specific residency programs quite early. If you impress during your medical school, you don't have to even, I think, right after house job, you are allowed to enter whatever residency program of your choice if you impress in medical school. Currently, I think that's one of the trends. For radiology as well, it has been marked as one of the priority specialties in Ghana. And so also they are admitting people in like without you having to do 2 years or 3 years as a medical officer. And even now, I think they are making it a straight fellowship program. Right now, you do 4 years as a member, and then another 1 year or 2 years to become a fellow. But now, straight fellowship, 5 years, you are done as a fellow. Right. So all those things are motivation to get in. But all I can say is, Charlie, decide early and then start preparing towards your primaries. Yeah, you don't have to finish house job before you write the primaries. You can write primaries as a house officer. I wrote primaries. Okay, well, I was done, right? I was done with house job, but I registered for primaries when I hadn't even gotten my permanent license yet. I registered for primaries. Some people I know wrote primaries while they were house officers, and I think that's best when the knowledge is still fresh. Because from my experience, it's more of medical school stuff. The questions that are asked, people will think that it's anatomy, in physics that are going to be asked. But really, it was, I think I had only like five basic physics questions that I didn't even require a calculator to answer in my primaries. It was general medicine stuff, like a medical school crash course kind of paper. So if you are fresh from medical school, the knowledge is fresh. You find it easier than someone who has been out of school for 5 years, 6 years, so to speak. Yeah. So that's it.
If you didn't do medicine, what would you be doing now?
Maybe computer engineering.
Eh,
Yeah. Yeah. I think I can see myself as a software engineer, like coding and making apps and stuff. Like I said I liked engineering in the first place.
Yeah.
Yeah, I still do. Unfortunately, thinking about what the time I would have to spend to learn all those things all over again, it seems long. So I'll just stick to my radiology like that,
Okay.
and maybe invest in that space when I have the means.
Sure. If you were to go back in time, would you change any of your experiences that got you where you are now?
Hmm, that's a tough one. It is all my experiences that have gotten me here. If I go back in time and I change something, I might not get here. But then again, oh, nah, nah, I don't know. I'll not change anything. No, no, no.
Okay.
I'll just probably, no, I'll not change anything. I'll not change anything. Maybe my mindset will be different, but the steps along the path would have still been the same.
Okay. So we are on our last but one question, and this is a special aspect of the show. You get
Okay.
to answer a question from our previous guest. So
Okay.
the guest before you asked or left a question for you, and the
Okay.
question was: aside Ghana, which other lovable country would you like to travel to?
Lovable country,
Yes.
and not for professional purposes.
No.
Just travel.
Yes.
Ah, these questions are difficult because I've not been anywhere else apart from in order to love a place, you should have been there at least once or twice.
Mm.
So it's all just speculation and fantasies. So for me, it's the Maldives that I have been eyeing. I've been eyeing the Maldives, and it's just because what they show us. Their beautiful beaches, the sea top cabins, and all those things. It looks quite. This is some place that you'd want to like get away with your significant other, like for a weekend or something. Yeah.
Okay. So on to your last question. You get to ask our next guest a question. So leave your question for the next guest.
I don't have to know who the next guest
You don't
is.
have to know who the person is, but
I,
definitely going to be in the medical
space. Okay. I
fraternity
don't
or
have to know what
space.
what topic you're going to be discussing with the next
No,
person.
just leave a
Just
question.
drop a question.
Yes.
Hey. Okay. What do you consider a must have in a partner?
Oh,
What do you consider a must have in a partner?
oh, I love the question. Okay, so dear guest, there you go. What do you consider a must have in a partner?
Yeah.
We hope you give us a very good answer. Okay, Dr. Aaron Dagadu, a
Yes.
multiple award winning doctor. Thank you so much for your time. Thank you so much for gracing our space, and we hope to see you sometime again. Until we see you next time. Bye.